In this video, I'm going to provide an overview of some of the superficial and deep muscles of the thorax and the shoulder. And if we start on the left-hand side, what we're viewing here are the more superficial muscles, and then we'll take a look at some of the deeper muscles that lie underneath the superficial ones. The very large muscle that you see here drawn on the posterior side is the trapezius muscle, and it's a very broad muscle that extends from the occiput or the occipital bone as far down as the lower thoracic vertebrae, and it is divided up into what are called the upper, middle, and lower portions of the muscle. And when this muscle contracts, it will pull the insertion towards the origin along the spine and will elevate the shoulder. So it will move the shoulder in a superior direction, and it will retract the shoulder, which is to pull the shoulder into a posterior direction. Deep to the trapezius muscle that we see here on the right hand side are two other muscles that are referred to as the rhomboid minor, named because it is a smaller muscle, but it is the more superior one, situated to the rhomboid major, named accordingly because it is a larger muscle than the minor muscle, but it sits more inferior to the rhomboid minor. And when these deeper muscles to the trapezius contract, they have a similar function as the trapezius in that it will pull the insertion towards the origin located along the spine and will retract the shoulder. So the shoulder will move into a posterior direction, essentially having the effect of pinching the shoulder blades together. The very large latissimus dorsi has an insertion onto the upper portion of the humerus, not illustrated here because it's covered by the deltoid, but it originates along a very broad band of the spine. And when the latissimus dorsi contracts, it will pull the insertion towards this origin, and in doing so, it will adduct the arm. It will pull the arm towards the body, as well as producing an internal rotation of the humerus. And of course, the arm adduction occurs in the frontal plane, while the internal rotation occurs in the transverse plane. On the right-hand side of this picture, we see the deeper muscles to the trapezius, and located, as we can see here, originating from the upper cervical vertebrae, the transverse processes, as well as the vertebrae themselves, the main portions of the vertebrae, is the levator scapula. And as the term suggests, this will have the function of elevating the scapula. So it once again will pull the insertion towards the origin and will have the effect of a person performing a shrugging type of maneuver as the scapula moves in a superior direction. And I just want to point out the bony landmark of the spine of the scapula, which is quite prominent. These other muscles we'll touch on in a few slides, but not in this video. These four muscles are referred to as the rotator cuff, but we'll address that on slide 24. Some additional muscles here on the anterior side that was discussed earlier is the deltoid, pointing out the very large superficial pectoralis major. The coracobrachialis muscle, as can be slightly seen here, is a muscle that is deep to the pectoralis major and deep to the biceps brachii. The three muscles that I'll address here are the biceps brachii, which is the superficial muscle on the anterior arm. Deep to the biceps brachii is the brachialis muscle, and you can just see the edges of that muscle here as it lies deep to the biceps brachii, and the brachioradialis, which is on the lateral side of the forearm. It originates on the humerus, but it extends down onto the distal forearm. Now, the deltoid muscle is made up of anterior, middle, and posterior portions. So when this muscle contracts, it will produce arm flexion when the anterior portion contracts. So arm flexion would see the arm elevating in the sagittal plane. When the middle portion is active, it will abduct the arm, which is to move the arm upward in the frontal plane, and arm extension generated by the posterior portion of the deltoid would move the arm into a posterior direction, and that would occur in the sagittal plane. The pectoralis major, which inserts onto the humerus, and you can see the pectoralis major has a relatively broad origin along the clavicle and the sternum and down into the costal cartilage of the first rib. When this muscle contracts, it has the action of horizontally abducting the arm. So when the arm is placed in a horizontal position, the pectoralis major will have the effect of moving that arm towards the midline of the body, as well as internally rotating the humerus, which would occur from the anatomical position in the transverse plane. The biceps brachii functions to flex the elbow. So when this muscle contracts, it will essentially pull the forearm closer to the upper arm. But because this muscle also crosses the shoulder joint, which is not evident here because it runs deep to the deltoid and the pectoralis major, because it crosses the shoulder joint, it will have the effect of flexing the upper arm, which is to move the arm in an anterior direction in front of the person, and that motion would be in the sagittal plane. And because this muscle crosses the elbow, it also contributes to forearm supination, and that is the position of the hand in the anatomical position where the palm is facing forward. The brachialis muscle is the most active muscle during most elbow flexion maneuvers. And so as you can see here, once again, you just see the edges underneath the biceps brachii. The brachialis muscle is the one that we use typically for low force needs in terms of elbow flexion. But when we have greater needs of elbow flexion, then we start to activate the biceps brachii. The brachioradialis, as I indicated earlier, originates on the distal humerus and inserts onto the distal forearm. And when this muscle contracts, it will also contribute to elbow flexion because it does cross the elbow joint. But that occurs typically when the forearm is in a neutral position. And a neutral position from the anatomical position is where the forward-facing palm is rotated 90 degrees so that the thumb is facing forward, and that is the neutral position. If you were to continue rotating your palm where the back of your hand, the dorsum of your hand, is facing forward, that would be a fully pronated position. So this ends this brief video on some of the superficial and deep muscles of the thorax and the shoulder.